TNF-alpha plays an important role in the cyclic inflammatory signaling that contributes to psoriasis. T helper cells produce cytokines, including TNF-alpha, that promote keratinocyte proliferation and activation, as well as neutrophil recruitment. TNF-alpha and IL-22 bind to their receptors and activate signaling in keratinocytes. Continuous keratinocyte proliferation and activation result in the characteristic epidermal thickening seen in psoriasis. TNF-alpha and interferon gamma act on blood vessel endothelial cells, resulting in blood vessel activation. Activated adhesion molecules within blood vessels recruit T cells and dendritic cells. TNF-alpha, IL-1 beta, and IL-6 are produced by activated keratinocytes. TNF-alpha, IL-1 beta, and IL-6 activate dendritic cells, encouraging further immune cell recruitment and activation. Pro-inflammatory mediators including IL-17, IL-23, IL-6, IL-1 beta, and IL-12 stimulate production of additional TNF-alpha. Increased production of TNF-alpha and other cytokines stimulates heightened immune response. Amplification of cytokine feedback leads to continuous inflammation. In plaque psoriasis, TNF-alpha overexpression is a key factor driving chronic inflammation. Clinically, HUMIRA, adalimumab, was found to be effective for the treatment of moderate to severe chronic plaque psoriasis. Treatment with HUMIRA may reduce epidermal thickness and infiltration of inflammatory cells. The relationship between these pharmacodynamic activities and the mechanism by which HUMIRA exerts its clinical effects is unknown. HUMIRA is effective in treating both moderate to severe chronic plaque psoriasis and psoriatic arthritis. TNF-alpha plays a central role in the pathogenesis of both diseases. In psoriatic arthritis, PsA, elevated TNF-alpha and other cytokines in the synovium and synovial fluid drive pathological inflammation and joint destruction. Activated dendritic cells secrete TNF-alpha, IL-6, IL-12, IL-23, and IL-1 beta, leading to differentiation of T helper cells. T helper cells produce increased amounts of pro-inflammatory mediators, including TNF-alpha, in the synovial fluid. Blood vessel activation facilitates infiltration of interferon gamma-activated macrophages, which produce TNF-alpha. Synoviocyte proliferation, driven by TNF-alpha and IL-22, leads to thickening of the synovial membrane. TNF-alpha and additional cytokines activate cells that promote bone and cartilage destruction. PsA is characterized not only by bone erosion, but also by abnormal bone formation. Overexpression of cytokines, including TNF-alpha, perpetuates the cycle of inflammation and joint destruction. Progressive joint destruction may occur as early as within the first year of diagnosis. Clinically, HUMIRA was found to be effective for the treatment of psoriatic arthritis. Treatment with HUMIRA may inhibit progression of joint damage. The relationship between these pharmacodynamic activities and the mechanism by which HUMIRA exerts its clinical effects is unknown. HUMIRA is effective in treating both psoriatic arthritis and moderate to severe chronic plaque psoriasis. TNF-alpha plays a central role in the pathogenesis of both diseases. Patients treated with HUMIRA are at increased risk for developing serious infections that may lead to hospitalization or death. These infections include active tuberculosis, TB, reactivation of latent TB, invasive fungal infections, and bacterial, viral, and other infections due to opportunistic pathogens. Most patients who developed these infections were taking concomitant immunosuppressants such as methotrexate or corticosteroids. Lymphoma, including a rare type of T-cell lymphoma and other malignancies, some fatal, have been reported in patients treated with TNF blockers, including HUMIRA. Patients treated with HUMIRA also may be at risk for other serious adverse reactions, including anaphylaxis, hepatitis B virus reactivation, demyelinating disease, cytopenias, pancytopenia, heart failure, and a lupus-like syndrome. Please see additional important safety information, including boxed warning on serious infections and malignancy, on the page below. Please see full prescribing information by clicking the link at the top of this page.